This is ORS, that is the oral rehydration solution. Oral rehydration solution. This is very important. And a first aid remedy. So to ask a few questions. First one, what is the amount of chloride which is present in the ORS? Next, what quantity is 20 in amount in the ORS? Third one is, what is the total osmolarity? Total osmolarity of the ORS. So by the end of the video, these answers will be addressed and you will learn a lot more. So next we are going to see is the composition, as we know. So here it is sodium. Sodium is about 75. The units here we are totally discussing about mmol per liter. So first one is sodium. Then if you see it is chloride. Chloride is 65. Then is the glucose. Glucose is anhydrous and this is about 75. So in 75 there are two, that is sodium as well as glucose, which is anhydrous. Next is we see is potassium. Potassium is 20. Then is citrate. Citrate is 10. So next what we see is total osmolarity. Total osmolarity. Total osmolarity is nothing but, if we add up, say 75 plus 65, it is 140, 140 plus 75, 215, 215, 20, that is 235 and then 245. That's how we get to 245. So now answering the questions, what we discussed. So to recap, we have sodium, we have chloride, we have glucose. Next we have potassium, we have citrate, and the total osmolarity adds up to 245. So we discussed the questions, that is chloride. The first question was chloride. So what is the amount of chloride which is present? So chloride is 65 mmol per liter. And then we discussed what is present, 20 mmol per liter. What is that is present? So it is nothing but the potassium which is present in 20. Then what is the total osmolarity? Total osmolarity is 245. So how did we get this 245? Sodium is 75, chloride that is 65. So it adds up to 140. And then we had the glucose which is 75. This is nothing but 215. And then we have the potassium and the citrate. So totally it adds up to 245.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.